It's my pleasure to present to you this short study on comparing phacoemulsification to nanosecond laser as far as the early and long-term endothelial cell density and morphology. The associate authors on this paper are George Hadjilau from Athens, Greece, Ivan Tanev from Sofia, Bulgaria, Georgia Simalis, and John Kanellopoulos from Athens, Greece as well. Capture X is being performed. Lens fragmentation. The R technique, which is going in with viscoelastic, completing the lens separation. And I will complete this case. This laser is called CETUS. Grasp or purchase the first quadrant of the pre-dissected cataract with a femtosecond laser. And here the laser pulses emulsified and then further become absorbed by the nanosecond laser probe. This is John Kanellopoulos signing off in Greece. 82 eyes of 41 patients were subjected to uneventful cataract surgery with implantation in all eyes of an acrylic intraocular lens. Each patient received randomly phaco in one eye and nanosecond laser-assisted lens emulsification in the other eye. The nuclear sclerosis was graded with the lens opacities classification system 3. The parameters analyzed pre-op and 2 years post-op were the effective phacoemulsification time and total energy for the phaco group, and respectively for the nanosecond laser group, the number of laser pulses and total energy dissipated for cataract removal. Also, all cases had endothelial cell density measured and endothelial cell size variability preoperatively and up to 2 years postoperatively. The endothelial structure was evaluated by measuring the central endothelial cell density, cells per millimeter square, coefficient of variation in size, which is an objective measure of polymorphism, and percentage of hexagonal cells, CV6, and index of pleomorphism, percentage of hexagonal cells. In results, we found that the mean phaco time was 7.26 plus minus 44 seconds for the phaco cases, and that represented an average energy of 4.2 joules. And in the nanosecond laser group, the average number of laser pulses were 243 plus minus 188. And considering that each laser pulse released 7.5 millijoules, this is a 14 nanosecond duration. The mean amount of energy dissipated in each case with a nano were 1.83 joules. The mean endothelial cell density in the ultrasound group was 2517 and at 2 years 2287. In the nano group 2521 and at 2 years 2420. Statistically significantly better. The mean endothelial cell size variation in the phaco group was 27.6 at 2 years 30.6, showing some enlargement of the amount of polymorphism. In the nanosecond laser, the relative numbers were 27.9 and 27.2, a much smaller polymorphism development up to 2 years. Similar numbers, 42.3 up to 37.74 at 2 years for phaco, and 42.8 remaining at 43 at 2 years for nano showed the significant differences. In this slide we can see the graphics which show, illustrate rather better the endothelial cell counts, the endothelial cell density, as you can see on the top left between the nanosecond laser in blue, retaining the numbers up to 2 years with an initial slight drop, and the ultrasound, which is the dotted orange line, showing even initially a more significant drop in endothelial cells, and these numbers stand same comparison to laser up to 2 years. On the graph under that is the variation of the cell size, which is less in the nanosecond laser graph, which is again the solid blue line, and the dotted orange line is the phaco group, and on the top right is the graph showing the hexagonal cells present from early post-op up to 2 years. Again, solid blue line is the nanosecond laser group, and the dotted orange line is the phacoemulsification group. And also to note on the bottom table is that the same parameters for bottle height and vacuum, as well as aspiration during the procedure for both groups, in order to have similar parameters for both groups. Modern cataract surgery is one of the most successful types of surgery when considering the improving of the patient's quality of life and the safety profile that it has developed in the last few decades. The expected outcomes today include reduced surgical trauma, smaller incisions, improved intraoperative ocular stability, advanced performance, capability of intraocular lenses. And we as ophthalmic surgeons are in constant search for refined techniques and instrumentations in order to improve safety and the patient's outcome. We know that ultrasound energy may affect ocular structures and has implicated pathogenesis of endothelial cell loss and cystoid macular edema. Cell loss due to the energy released within the anterior chamber, and also possibly due to the thermal effect of the probe entering the cornea in a clear cornea cataract surgery incision model. The corneal edema is one of the most frequent early postoperative complications of phacoemulsification, and this complication may sometimes lead to permanent serious visual disturbances. Postoperative corneal swelling and endothelial cell loss are related to many factors, including phacoemulsification time and energy, cataract density, corneal pathology, surgical technique, anterior chamber depth, axial length, ocular trauma, free radical development from the ultrasound entering into the anterior chamber, mechanical and heat injury, as mentioned before, the technique of each surgeons, and also the circumstances of each procedure. So in this small study, we found that the nanosecond laser-assisted cataract surgery presents some significant advantages when looking at long-term endothelial cell counts compared to ultrasound phacoemulsification. Number one, we saw that there is reduced total energy used per case, almost half in the nano cases, and this is probably the factor that implicated a better long-term endothelial cell density in the nanosecond laser cases. That was significantly statistically, and with that comes along the better long-term cell structure availability and hexagonal cells. Although most cataract procedures are monitored at 1 or 3 months for safety, we demonstrate herein some significant differences using traditional phaco 2 nanosecond laser for lens emulsification in very long-term evaluation. It appears that the reduced intraop energy used and or the absence of potential thermocorneal trauma from the phaco probe and not present with the nanoprobe provides better long-term endothelial cell safety data. Thank you.